Hello, we are Group 13. I am Liu Yihan and my teammate is Chen Youda and Zhang Kesen. We think the issue we face now is that data are severely lacking in manpower. They do not have the time or resource to dedicate to basic analysis like narrowing down the problem that could be done by AI. Therefore, our objective is using AI to analyze medical imagery to help us understand the patient potential problems and how we can help to solve it. We hope that we can lessen some of the doctor's problems if we were to use AI to take care of some basic analysis. In this report, we plan to test the AI on its ability to determine basic problems occurring to the patient in medical images. And we type the keyword tumor CT scan on Google to find its intracranial tumor image. Next, we give ChatGPT a question. What may be the problem of this patient in the imagery with this intracranial tumor image? And ChatGPT's answer had two main points. The first one is what the CT image shows. We can see on the left side of the brain there is a irregular hyperdense lesion that means it looks twice than the surrounding brain tissue, so that the patient may have intracerebral hemorrhage. Besides, we also can see there is some surrounding darker areas that this place possible have edema or swelling. They also suggest that the lesion is pushing the brain tissue slightly. At least, this patient may also have possible underlying mass. The second one is about common medical possibility. This patient may be afflicted with acute intracerebral hemorrhage stroke, or hemorrhage into a tumor and brain contusion.
Hello everyone, let's talk about the first question. How did ChatGPT determine the problem? First, it will consider the density patterns. Look at the picture. The left hemisphere of the brain shows a very bright area, which represents a high-density substance. The most common cause for this is acute hemorrhage. It means acute bleeding. Number two, you'll consider shape and borders. The lesion in the image presents as a round or irregular shape. This appearance is commonly seen in acute hemorrhage, as well as blood clots beginning to change and mix their components. Number three, location in brain tissue. The lesion is located within the brain parenchyma. This allows us to exclude conditions such as SDH, EDH, and IVH. Number four, surrounding effects. We observe evidence of edema and mass effects on the surrounding structures. This is commonly seen in intracerebral hemorrhage, ICH, and hemorrhage within a tumor. Pattern recognition from typical CT cases, acute intracerebral hemorrhage, ICH. Okay, the next question, we offer ChatGPT and acute information. This is accurate information. The question is, this is a picture of an intracranial tumor. What might be some treatment? The first treatment ChatGPT recommend is surgery. Just cut the tumor off. And the second therapy is radiation therapy. This includes conventional radiotherapy and stereotactic radiotherapy. And the number three is chemotherapy. Number four is targeted therapy and immunotherapy. And number five, we can observe it if the tumor is small, symptoms are mild, and growth is slow. The physician may opt for regular MRI follow-up instead of immediate treatment. And the third question is, how do you determine which treatment to use? Can you give me some sources? Here, GPT offers us 6 6 tips. The first is determine the tumor type. The second is evaluate all probability. The third is determine the tumor grade. The fourth is look at the patient factors. The fifth is examine tumor location and size. And the sixth is look at the presence of swelling. But we want some reliable medical sources, so we ask it again, and it reply 6 reliable medical sources. The first is National Comprehensive Cancer Network (NCCN) guidelines. Number 2 is up-to-date brain tumor treatment chapters. Number 3 is World Health Organization (WHO). And number 4 is American Association of Neurological Surgeons. Number 5 is American Brain Tumor Association. Number 6 is National Cancer Institute (NCI).
Now, let's get on to the last point, follow-up 4. Can you provide us with more information on tumors? Now, obviously, if we were to help the patient with their problems, which is tumors, we need to learn more about them. And this is the reply that ChatGPT gave to us. First of all, and something that we all know, is that tumors are abnormal growths of cells. And second, brain tumors include types such as gliomas, which consists of 30% of brain tumors and 80% of malignant tumors, meningiomas, which is a slow-growing type of tumor, and the pituitary tumor, which is mainly found in the pituitary glands. And third, tumors have no known causes, but factors such as radiation exposure, genetic disorders can increase the risk of getting tumors. And fourth, general symptoms of tumors include, but is not limited to, nausea, confusion, fatigue, and headaches. These types of symptoms are especially prevalent in tumors that are found in the brain. And lastly, brain tumors can be diagnosed through the following methods: CT scans, MRI scans, biopsy, or genetic testing. Now, after that, let's move on to our personal comments. How was our experience with ChatGPT? What are some things that ChatGPT offers, and what are some things that it might lack? For the pros, ChatGPT provided very detailed answers for every question, and it is able to explain answers clearly in a way that someone like us, students that are not specialized in tumors, can be able to can easily understand what it's trying to say and the information that it's trying to convey. However, now let's move on to the cons. ChatGPT could use more pictures or graphs instead of only text-based answers. We feel that the inclusion of pictures or graphs will allow us to get a more thorough understanding of what ChatGPT is trying to convey, since looking at long or large bodies of text is really tiring. And next, it cannot accurately determine what the exact problem is. As you can see from the slides that we have already presented, ChatGPT is only able to narrow down the problem to several different types. However, it's not able to pinpoint what exactly is going on in the picture that we presented. And lastly, some answers, unfortunately, are not related to our question. Sometimes ChatGPT goes off track and started answering things that we did not ask about. Now, thoughts. What are our thoughts after using ChatGPT for this goal? Let's give a summary. Now, as I have already presented in the pros and cons section, ChatGPT is a good tool for organizing a large amount of information. However, it is unable to get into the more specific details of what each image entails or what each image is trying to show. So, although it can be used to soften the burden on the doctors, allowing them to take some time off without the need to analyze every single image in detail, it cannot completely replace what doctors have to do in analyzing the pictures and understanding what the pictures is actually trying to convey. It can only do the most basic kind of research and analyze the most basic kind of pictures. And lastly, what are our hopes for the future of AI? We hope that with the progression of AI, these types of generative AI can get more and more accurate. They can get more and more knowledgeable. They can expand their they can expand their databases. So this way, they can know more about what problems are plaguing the human body and fix the cons we mentioned just now, which is not being able to identify what is going on in the picture. This is something that we hope the future of AI can hold for us. And we hope that ChatGPT can and will be able to replace doctors in this place, which is like a diagnosis of the images to soften the burden on them. And this is our work distribution table.